Good afternoon, everyone, and thank you for joining today's webinar on topic Managing Cancer Treatment Side Effects Through Diet and Holistic Wisdom. I am your host, dietitian Divyasri Sharma, DS Research Center, Guwahati. So we know that cancer treatment can be extremely challenging, not only physically, but also mentally and emotionally as well. And the biggest struggle is that patients also face a lot of side effects through the cancer treatment. But the thing is, most patient, they doesn't realize that nutrition can also help to reduce all these side effects along with the medicines. So today we are here to discuss about these important topics, and we have inspiring women in medicine and nutrition. Dr. Divya Ma'am, BAMS MD, Panchakarma, DS Research Center, Bangalore. Dr. Sabnam Sultana Ma'am, BAMS, Ayurvedacharyas, DS Research Center, Guwahati. And dietitian Meena Kumari Ma'am, MSc and MPhil in Food Nutrition and Dietetics, DS Research Center, Bangalore. So let's begin this meaningful session, and I welcome you all. So my first question is to Dr. Sabnam Ma'am. So ma'am, what are the most common side effects that patients mostly experience during their cancer treatment? What are the most common treatment that patients face? Ma'am, you are not audible. Sorry.
So, am I audible?
Yes, ma'am, you are audible.
Sorry for the interruption. Okay, so the most common side effects seen in patients undergoing chemotherapy or radiation or other forms of modern treatment, whatever they prefer. So, first symptoms mostly starts with all the GIT symptoms, or gastrointestinal tract symptoms like nausea, vomiting, and diarrhea. And along with that, patient also suffers from lots of mouth oral infections like mouth sores and tooth decay and lots of infections in mouth. Like mucositis is also one of the infections in the mouth. Post radiation or post chemotherapy side effects. Actually, the symptoms persist and it affects the patient mentally, not only physically but also mentally a lot. So. It can be divided into three categories. The symptoms, like it can be acute or intermediate or in late. So if the treatment is the patient is taking treatment for 1 month, after 1 month, so after taking 1 month of the chemotherapy treatment, you may see symptoms like nausea, vomiting, diarrhea, and constipation, and lots of problem type of. It starts with GIT, gastrointestinal. Again, if the treatment starts for longer, like around 5-6 months or 7 months, that's an intermediate stage, you will see the patient will start having problem like fatigue and anorexia and loss of taste in the mouth. Patient starts having anemia problems. Patient also starts having lots of problem in the sensitivity, both in skin and in the mouth region. Also, they can't take food which are very hot or sour or salty foods. They find difficulty in eating, and then they also suffers from loss of appetite in the long run. And what happens in the last stage, that is after taking 1 year or 2 year, that mostly the cancer survivors, if you see, you will see most of the patient having complaints like esophagitis or pharyngitis or laryngitis or persistent dysphagia, and also affects the hair part, the alopecia. Patients suffer from alopecia, and sometimes it also affects in the last stage, that is it also affects the infertility, and some cognitive differences also seen in the patient. Patient's memory becomes very low, less, and patients start forgetting things very easily. So these are the worst side effects seen in modern treatment, and it is really very bad. Or actually, people gets confused whether these are the treatment, whether these are symptoms of the normal disease or the side effects. So we, being a medical practitioner as an Ayurvedacharya, we should always spread awareness to the patients or to the cancer survivors that these are the side effects of the modern treatment, and there are actually which actually disrupts the quality of life of the patient. So we should be very much so these things, it needs immediate medical care and attention. So we should spread awareness to people about these side effects of this treatment, so that people can come forward and seek help from us.
Okay.
As fast as they can.
Okay, thank you so much, ma'am. And you explained all the side effects very nicely. So let's move to the next speaker, Dr. Divya ma'am. Ma'am, can you please explain why mostly the patient experience the side effects like hair fall, then numbness, and eating difficulties during the treatment, and how long this side effect lasts? And does it affect the patient mentally? What do you want to say about this?
The main reason why cancer patients will experience the side effects during the chemotherapy is because the medicine that is used in chemotherapy is designed to recognize the fast growing cells. So it doesn't recognize the healthy cells or it doesn't recognize the cancer cells. It recognizes fast growing cells. So there are cells which are naturally fast growing. For example, WBCs, white blood cells, which are also the soldiers of the body, they are prone for destruction during a fight with any infections. So they are fast growing. So during chemotherapy, the WBCs are destroyed because they are fast growing, and which leads to lowered immunity. And that is the reason why cancer patients are advised not to take raw food and not to go in crowded places because they have a compromised immunity. Then coming to the hair follicle. So hair follicles are also fast growing cells which will be destroyed by chemotherapy, and that's the reason why people have hair loss. And then mucous membrane is a fast growing membrane. Now mucous membrane is lined throughout the GIT. So from mouth till anus, that is gastrointestinal tract, has one layer of mucous membrane which will be affected by chemotherapy, which leads to inflammation of the mucus, also called as mucositis. And this is the reason why patients will experience difficulty or burning sensation when they have food. Now, that can be because of solid food, soft diet, liquid food. Even with water, few patients might have burning sensation and mouth ulcers, and then symptoms of hyperacidity, unable to have food, and having loose stools. No, all these symptoms are because the mucous membrane is inflamed. And then you have the nerve endings. They are also fast growing cells. So nerve endings, when affected by chemotherapy, it leads to peripheral neuropathy, which is numbness, having numbness in the palms and feet. Now all these side effects are actually self limiting. So body has this natural mechanism of healing itself whenever something goes wrong, but it takes its own time, usually around 1 week's time. Around 1 week's time the side effects will subside, and it is also dependent on the immunity of the patient. Now if the immunity is good, then the recovery will be faster. If the immunity is less, then the recovery will take more time. Now, this becomes an important aspect to know the gap between two cycles of chemotherapy. Like if it is 21 days of gap, then the patient will recover, will have time to recover, and the body will be ready to take up the next cycle of chemotherapy. Now, if it is once in a week, then by the time the patient starts feeling a little better, then the next cycle will be scheduled. So that becomes a little challenging for the cancer patients to handle the side effects. And definitely, all such symptoms are going to affect a person psychologically. Even otherwise, any person, if he sees his hair falling off in bunches every day, it is quite disturbing. And most of the patients will not reveal the diagnosis of they being affected with cancer to the society, and these are the symptoms which actually shows up to the society that they are cancer patients. That is psychologically disturbing. Because of weakness, there will be irritability, and patients will also be a little dependent on the caretaker or the family members when they are facing this problem of side effects during chemotherapy. During their in their daily routine, they will be little dependent on the family members. So all these factors do affect patients both physically and psychologically.
Okay, thank you so much, ma'am. You explained all the things in very detail. And yes, mental health is also very important, and patients should focus on mental health also, as well as physical health, so that they can give a good response to their treatment, right? So, okay, next question I would like to ask Sabnam ma'am, as we are working at DS Research Center. What do you want to say about our medicine, like our ancient Ayurveda-based medicine, how they help to reduce the side effect that caused by the modern treatment? What do you want to say about that?
So at DS Research Center, we provide Ayurveda-based nutrient energy therapy treatment. So that is completely Ayurveda. So Ayurvedic, and it has no side effects. So patient can naturally take it very nicely with no any difficulty. Unless except like our modern treatment, which generally causes lots of side effects, our treatment has zero side effects, and patient can take it very in a very safe way, with no any confusion or with no any tension or stress of whether it will cause any side effects or not. Because most of the patients, whenever they visit our center or clinic, they always have this confusion regarding whether your medicines will cause side effects will along with while taking along with a modern treatment. But the good part is that our treatment generally provides lots of benefits to the patient who is undergoing a chemotherapy or radiation, or any forms of treatment for their whatever stage of cancer they are having. But what the benefits this provide is that our medicine, our treatment provides immunity, which is one of the most important thing in a cancer patient. Because as when a patient gets to know that he's having cancer, you will naturally get to know that his hemoglobin level has fallen down, or he is having lots of deficiencies. His WBC count has gone up or down. Again, his platelet count may fall. You may see patient having lots of appetite. You may see patient complaining, having lots of weakness. Post-treatment and pre-treatment. Even if they're taking chemotherapy, post-treatment also, they also come with the same complaints. And pre-treatment also, they come also say when they're diagnosed for morely like a year, they come with a complaint with lots of symptoms. So our main responsibility is that that our treatment, even if they want to start or if they're interested to know about our treatment has actually added wonders to the patient. So our medicine, whenever we prescribe the medicine, we actually see the stage of the cancer. We actually see the state of the patient's disease, what type of complaints he's having, what stage he's in. So accordingly, we prescribe medicines on their state of the disease. So it actually adds immunity to the patient. So what happens in post after taking chemo or radiation, most patients have less immunity. As a result of less immunity, they suffer from lots of side effects of the treatment. So while taking our treatment along with the modern treatment, it actually helps the patient. Actually, the patient can tolerate chemo and radiation further to the scheduled date, because most of the patients are unable to take after 1 or 2 cycles of chemo. Because what happens is causes lots of side effects, like starting from GIT problems to hair loss to skin disorders to infections, lots of problems due to decreased immunity. So our medicines will be providing immunity. In this way, he can continue the treatment to the scheduled date, whatever modern treatment he's taking. And it actually helps in the digestion process also, our medicines. So I have seen many patients having increased appetite after taking our medicine, and their energy is back after taking our treatment or after continuing our treatment for many months. So these are the added wonders of our treatment, as Ayurveda is based on the belief that a healthy body is a state of the balance of the dosas. It is a state of balance between the dosas, dhatus, and the manas. That means the mind and the tissues and the business cell level. This is vata, pitta, and kapha. So what chemotherapy and radiation does is that it disrupts the balance of the doshas of the body, as per Ayurveda. So Ayurveda restores the balance. It harmonizes, it restores the balance, body balance. It balances the dosas, it balances the dhatus on both cellular level and on the tissue level. It balances everything, and it also provides wonders to mental health also once you start our treatment. So it helps in the body rejuvenation. It also fastens the healing process very naturally. So not like other modern treatment where like okay, modern treatment is good. It's not like bad. I don't want to say that it's very bad. It's providing actually, it's actually beneficial to some patients who have already completed 14 cycles, 15 cycles without any side effects. I've also found such patients who have little or less side effects compared to few patients who are having various side effects. But as going by the topic of today's webinar, so those patients who are having lots of side effects, alternative medicine, our Ayurvedic medicines provides lots of benefits to the patient. If any patient is suffering from uh, post treatment side effects, post chemo side effects, or post radiation, they can easily contact us and have a and start our treatment for and which will increase the quality of the life. And they will get to know once they start our treatment. But actually people have this misconception that Ayurveda treatment will not do anything like this to the side effects, or they will do very less as compared to disease. But actually our medicines are working wonders to the patient who have taken our medicines. So I would prefer people to switch to Ayurveda if they ever find, if they remain in the state of confusion what treatment to start now, because these side effects of the chemo and radiation generally it disrupts the quality of the life of the patient. Like not only physically, it affects them mentally a lot. Most of the patients suffer from mental health disorders after finding out that their chemo and radiation have not worked, and it has caused lots of side effects to them. So most of the patients have also faced death while fighting with the complications. So it is our responsibility to spread awareness about the importance of knowing the side effects, or spreading the education to the people that the side effects should be taken seriously while dealing with the disease. People actually give much more importance to disease itself. They think that okay, disease need to be cured, disease need to be healed, but actually disease disease will cause lots of complaint. Okay, I know that it will cause symptoms, but apart from disease, the side effects are the most major reason of patient suffering from every part of the problem these days. So this side effects part of the modern treatment should be taken seriously, and it should be taken care and given medical attention as much as possible. And Ayurveda helps a lot in this part. So if any one of our patient, if any one of you, or if any of the patient's family or attendant watching our webinar, I just want to tell you, please consult Ayurvedic practitioner, or come at our DS Research Center for immediate treatment for all the side effects, as it will add wonders to your patient. So, along with the treatment, I also want to add 2 points, that is the diet and the lifestyle. So, in treating the side effects of the modern treatment, diet and lifestyle also plays a very important, and the most important part is the diet part. So nutrition plays a very great role in combating the side effects of the modern treatment, be it chemotherapy or radiation, because people tends to think that okay, only medicines will do wonders for the treatment, for the side effects treatment, but actually nutrition plays a major role in treating the side effects. So we have 2 dietitians with us, Dibyashri and Meena. Coming to you, Dibyashri, can you please tell me why nutrition is very much important? Because most of the patients, whenever they come in our clinic, they generally have queries. So we generally counsel them according to from our point of view, from our medical point of view. But you are dietitian, so I also want to listen from your perspective, your view. As patient also wants to know from your point of view, being a dietitian, like why nutrition is so much important for these days. And can you please tell me, or can you please give me tips so that I can give to the patient, like how nutrition helps in reducing the side effects of the
Okay,
modern
ma'am.
treatment.
Okay, ma'am. Thank you for the question. And
Okay.
yes, nutrition is really very important for the cancer treatment, and it play a very important role in the treatment. And patient also face a lots of side effects, like they go through a lot, like weight loss and weak immune system. For this, only nutrition can help them. Okay, so only nutrition, if they follow a proper nutrition, then these side effects can be reduced. And like eating a healthy diet or a balanced diet can increase your immune system also. So maintaining a proper or balanced nutritious diet is very important to all the cancer patients. And also this only can, like a nutritious diet can reduce all the side effects. And yes, basically the food is the like part of healing. If you are eating properly, if you are eating well, then you will feel better. And if you will feel better, then you can also like respond to your treatment. So eating is very important. Some patients like they don't want to eat, or like they feel very tired to eat. But I want to say them like never keep your stomach like in rest. Always eat in small amount also. Nutrition is very important for the treatment. And yes, like for chemotherapy and radiation therapy, as Sabnam ma'am told us, like they cause a lot of side effects. Like for example, nausea, vomiting, then mouth discomfort. For all these, nutrition can help, and nutrition can reduce all the side effects. For example, if you are like suffering from mouth discomfort, then you can always go for soft or bland diet, and like soft and blended and small and frequent meal. That small and frequent meal, if you are like having nausea and loss of appetite, then you can go for small and frequent meal. And also it is very important to stay hydrated. Like you have to drink a lot of water. It can reduce the most common side effect, that is constipation and vomiting. And yes, patient also need to avoid a lot of things during the cancer treatment. These foods are like highly like high fatty food, then oily food, junk food, processed food like processed meats, also red meat, and high sugar and sugary beverages, and fruit juice, packaging fruit juice, mostly packaging fruit juice, then papar, asar, and all the refined grains. All these things patient need to avoid. And mostly I have experienced patient asks me about the packet fruit juice name like real fruit juice and diet coke. Ma'am, can I drink this one because it is labeled like real fruit juice and diet coke? It may be healthy, but no. I suggest don't eat, like, sorry, don't drink all kind of drinks, because they also contain a lot of sugar, and a lot of sugar also harmful for the cancer patient. Sugar, we all know that sugar increase the cancer cells to the cancer patient. So I request all the cancer patients don't drink all the packet fruit juice. If you want to drink any kind of drinks, like then you can go for homemade fresh fruit juice. These are the options. And also as a dietitian, I'd like to say, if the patient is like suffering from loss of appetite and he's tired of eating anything, he's not willing to eat anything, then he can go for small and frequent meal, eat in 2 to 3 hours of interval, but never skip any meal. Okay, if you skip meal, then your stomach will be empty, and empty stomach can lead to weakness. And if you are weak, then you can't like respond to your treatment. Okay, so always, if you are weak, like if you are like loss of appetite, if you are having loss of appetite, and if you are tired also, then always go for a small meal, light meal, like smoothie, juice, and soup you can have. And it is very important to intake a high protein diet. Almost at least 0.8 to 1.5 gram per kg body weight protein should consume a cancer patient every day. And it should be from animal-based protein or plant-based protein. But plant-based protein is like more comfortable. Like means plant-based protein is very good, more than animal-based protein. And also patient, if they are having like diarrhea, then they can choose low fiber diet. And if they are having constipation, then they should consume a high fiber diet along with a lots of water for proper digestion. And yes, they can include a like mild of spices in their diet for taste, but don't use a lot of spicy, because like spices or chilies, because it make your stomach upset. So, and I would like to suggest all the cancer patients that always choose a easy to digest food, then whole grains and fresh fruits and vegetables, high protein food. These are the small tips from my side. Thank you so much. And
Okay, sorry to interrupt you,
okay.
Divyashi, but another one question. Like, most of the patients come and just tell me, like, give one specific, or tell me some tips, like, to me, like, normally we see patients having weight loss.
Yes, ma'am.
Normally, yeah. So, what, any oil, specific oil, like whether
Yes,
we
ma'am.
there are lots of oil in the market now, like starting from groundnut oil to mustard oil to
Mhm.
ghee, to everything. So, what is a safe option for their so that the weight also gains, and they don't have to take the bland food every day. So
Okay.
we always ask for tips. So what oil should I
Okay,
advise?
for ma'am oil, they can go for rice bran oil, then canola oil and sesame oil. This kind of oil they can use
And
rather than mustard oil.
what about ghee? It's like, is the safe option for the
Yeah,
cancer
like
patient?
if the patient is having cancer in the digestive, like
Tract.
digestive tract, then they should avoid ghee. But
Okay.
and other than other cancer, they can go for ghee. No issue with that. Ghee also they can take.
Thank you so much. Okay.
Okay, ma'am. And we have also other nutrition expert with us, dietitian Meena Kumari, ma'am. So, ma'am, I want to ask you what food that helps improve appetite in patient during the cancer treatment, and how does nutrition help in, like, how does nutrition help in sense the different stage of cancer treatment before, during, and after?
Thank you, Divishri, for posing this question. And you have already well said everything is like the patient need to go for a balanced diet and they have to like what type of food they're supposed to have and all those things. And the ma'am was asking about the oil. I would like to add up one thing. It would be good if they could add up some cold press oil. That would be a better option on that. Oil, they can have a different varieties of oil. It doesn't matter. How much quantity you have is what matters. That's like. So next is like when you ask for the appetite during chemotherapy, we all know that the has both the doctors have discussed a lot on how what are the side effects and what type of they generally the first thing which comes is like loss of appetite. So how to improve on the appetite base? Loss of appetite could be so many reasons. As we know, it can be either nausea, it can be vomiting, sometimes even it can be emotional stress, which most of us forget about it. So when we as a dietitian, when we sit with the individual, we will come to know what is the main side effect of that patient, and we'll try to work on that particular side effect. So if it's going to be like a loss of appetite, we will just see what could be the reason for it and work on that particular side effect that would help. So to increase the appetite, what we can do is like maybe if the most of the time, if you see, during the first few initial chemo, they would not experience, they would say, I was quite happy. And the first few cycles, 6 cycle, 4 cycle, I didn't have any symptoms. I was perfect. I went to office and all those things. When there is a repeated chemo, what happens? Initially, your body has a good immune system. As Dr. Divya said, like the person should have a good immune system. So if you don't have a good immune system, what happens as on a repeated chemo, your immune system is bombarded and it's affected. So when on the repeated chemos, what happens? Your appetite comes down. You will start facing one of the other side effects of the chemos. So when these side effects, for example, when there's a loss of appetite, how they can improve on the appetite is like they can have a ginger water, maybe a pinch of ginger can be like crushed and boiled. Uh, and that water can be had half an hour before lunch or dinner, because most of the time if you see, the patient will complain, I am not able to have my lunch or dinner, or I'm having my lunch at a late time because I'm not hungry. Because in the morning they would not have, they would be like okay with, because the overnight fasting they would be able to eat something, but after that they would not be able to eat the quantity of the rice. So during that time what you can do is like, maybe you can just give a ginger candy after the breakfast. If you can suggest some ginger candies, they can buy and keep some ginger candies and have it after the breakfast. That will trigger the appetite. Or the other options is like when during the breakfast, if it's a North Indian dish, you can also with the roti, they can just spread some mint chutney or tomato chutney or a ginger chutney and roll and have it. So this would increase our appetite for the next meal. Or the other option is like already our other dietitian Divishri said like to have a small and frequent meal. That is a great and the best idea. Like instead of having three major meal, try to split a meal for every 2 hours. First meal you have maybe a solid meal, next should be a liquid. So solid liquid. So automatically you will have a good appetite. A small frequent meal would really help a lot. So next what they can do is like they can also like ensure that they can have soups. Soups like before the meal will also increase their appetite and make sure they're ready for the next meal. So if they concentrate, these are all small things. If they work on small things, for example, when they're having a tender coconut water in the mid morning, they can add little crushed mint leaves to it. That will also, this mint also can help in improving their digestion and help to have a better appetite. So the small things are taken care by the caretaker, then it is easy for the patient to like overcome the chemotherapy. All these things, they can handle it smoothly. So next thing what you asked was like different stages, like what type of nutrition works better for before, after, during, and after. So being a dietitian, what we look into when a patient, we know that if the patient is being planned for a chemo, if you know it before, maybe we have 2 weeks time, what we can do, we generally when we have to concentrate on the high protein and see what are the, because the body, first thing is like ideal body weight. If the patient is ready for the chemo, his body weight is perfect, he will be able to tolerate, he will be able to withstand and undergo the cycles of chemo. That's the first thing from the radiation point of view. Next, what we look into is like nutrition deficiency. So we need to, it's better if they have a blood routine test. We can see basically vitamin D, which is important for immune system, vitamin B12, and check all these nutrient deficiency and try to correct it. So these things, and hydrate them well. Once you hydrate them well, and the body is ready to take up the stress which is going to upcoming. So upcoming stress. So these three things, if you concentrate before the treatment, then the patient can easily handle the treatment period. Smoothly they can handle it. So during the treatment, we know like what are the symptoms. We already both the doctors have told we have a lot of symptoms that comes up during the treatment. If the patient is ready with all properly, if it's been like nutrient reserved, muscle mass is well enough, he will be able to run through at least 20 cycles easily without any symptoms coming across. Okay, but they haven't come. Maybe in the treatment phase to how to overcome these things is basically all the symptoms to overcome based on diet. What we can do, put them on a high, already Dibeshri has spoken about it, include a high fiber diet. Okay, I'm sorry, include a high protein diet, include a more colored vegetables and fruits in a diet. But as we said, the appetite, all things will work on it. I mean, it will help, it will be a disturbance factor for the patient to eat and all those things. So having, as we already discussed, small and frequent meal will help them to like overcome these symptoms during the treatment part of the thing. And when next stage is like the recovery phase. That is a after post treatment. That is if during this treatment, during the last phase, that is the recovery phase. As a dietitian, what we need to look into is like we will concentrate more on nutrient dense food, basically an anti-inflammatory and antioxidant rich food. In case if the patient has lost muscle during the treatment phase, muscle mass is lost maybe because of repeated diarrhea and all those things, the patient is not able to eat. This recovery phase, we will try to like increase on the protein and try to increase on the muscle mass strength, and so the patient is recovers very fast. So the nutrition plays a different role in different stages of cancer and what stage the patient comes in and how we need to handle the patient based on their symptoms and based on the requirement. The diet is being titrated well. And I would also like to add up that, as Dr. Shabnam has already told, like how our medicine really works wonder. So these medicines, other medicines, what happens like we have, as she said already, like we have an appetite stimulant. The syrup, whatever we have, helps in improving the appetite stimulant. And it increases their digestion, it improves their appetite. So the patient is able to eat well and they're able to, because the diet plays a very important role exclusively for the cancer patient because of the different phases. This other medicine helps along with the diet, helps do the, as Dr. Sharman said, it really does a miracle, and we have seen in a lot of patients. It helps them to easily pass through the treatment period and helps to recovery very fast. So the major thing which gets affected is like one is like appetite, next is the sleep, disturbed sleep. So our medicine really helps in these two things also, along with the working on the treatment part. So if these two things are corrected, all the simple things are corrected, half of the 50% of the problem of the patient is getting corrected. So this is how diet also plays a major role along with the medicine.
Okay, ma'am. Ma'am, I have one more questions to you.
Okay.
Like, what kind of foods that boost immunity to the cancer patient? And can you please share a meal plan, like sample meal plan, so which like support healing and energy?
Okay. Okay. So we all know that the cancer patient generally it has been like the immunity is compromised because of chemotherapy, because of radiation and disease itself. So, how to build their immunity? What are the foods to build the immunity? Is again what I would say is like the proteins food. Protein helps in repairing the cells and also helps in the functions of the cell. So the patient need to have a high protein diet in the meal. That is one of the reason we stress on it. So next, what is like vitamin C? Vitamin C helps in building up the WBC cells. So try to like include vitamin C rich foods like oranges and also like papayas, amlas in your diet on a regular basis. And next is like zinc. Zinc helps in improving the immune cell activities. So, what things we need to include in a high source of zinc foods? If you look into it, all the seeds like pumpkin seeds, you can include you can also include like walnut. You can include all these things. And apart from that, you can all the whole grains are also rich in zinc. Next is like omega-3 fatty acid also plays a major role because it has an anti-inflammatory property. So when including omega-3 fatty acid is which is rich in like walnut, flax seeds powder, and also it is a fatty fish. When you include all these things, it helps in faster recovering of the and building up the immune system in a better way. Along on a simple way, what I would say is like you can include a colorful plate which will include all these things. Okay, and along with that, apart from that, what you can additionally add up is like a probiotic, like a fermented kanji, which would improve on your gut and also improve the once your gut is good enough, your immune system is great. It is ready, fit for the to fight against the disease. So, sample menu you were asking, right? So,
Yes.
what I would say is like when you in the morning, what you can give if it is going to be a North Indian, it can be a poha with a handful of you can add maybe a peanut to it, and along it can be maybe a steamed sprouts, or if it's a non-vegetarian, you can add a egg to the breakfast. For the lunch, it can be either any fruits, it can be like a papaya or oranges, what we discussed on a vitamin C rich food can be included. Along with that, maybe a soup. Is not for the lunch, make sure there's one portion of dal. My main thing is like whenever you take up a plate for a food to have a main meal, make sure one portion of protein is compulsory there. It can be a plant source of protein, it can be a boiled lentils, dal, any of those things, or it can be a non-veg, it can be either a boiled egg, and it can be a fish. These things can be included in your diet, and make sure one portion is compulsory protein sources. Apart from that, for the evening snacks, you can have a roasted makana, or you can have your sweet potato, steamed boiled sweet potato. You can include, and for the dinner, it can be as light as like how we said, it can be like a khichdi steak. It can be dalia khichdi, or it can be a rice khichdi, or however it is like. When a patient follow these are the simple things. Before going to bed, maybe a pinch of turmeric in a glass of water will also help a lot.
Okay, thank you so much, ma'am. Hope patient will get some ideas to prepare their meal.
Absolutely.
Thank you. So my last question is for Dr. Divya, ma'am. Ma'am, I have experienced a lot. Like patient come to visit us, they ask about the combination of Ayurveda medicine and modern treatment. So they have that misconception like they can combine both treatment. So what is your point of view? What do you like? What message you want to deliver to the all patients like who has that queries?
DS Research Center medicines are absolutely herbal. Now, it doesn't have any metals or minerals in it. So, it can absolutely be taken along with allopathy treatment. Now, it is absolutely safe for all age group. In fact, when this medicine, Ayurvedic medicine, is taken along with the allopathy treatment, it is more beneficial, I would say, because DS medicines are improves the immunity of the patient. As I told you before, more the immunity, faster will be the recovery from the side effects. So it improves the immunity and gives the tolerating capacity for the patient to handle any treatment that you give. And when the immunity is better, recovery from the side effects is faster. When the immunity is better, the results towards any treatment that he is taking will also be better. Body will fight back against the disease and not just dependent on the medication, and the number and the intensity of the side effects will be less expressed in people who have better immunity. So in this way, in handling the side effects also, it will be quite supportive if they take a DS medicine along with allopathy treatment. And if in case the suppose the scans are all normal, the tumors are all gone, then DS medicine will help in avoiding the recurrence, because as long as the immunity is good, the disease will be either slow or very inactive. It will not express itself if the immunity is good. So during treatment and after recovery also, the Ayurvedic medicines, DS medicines, are going to be more helpful for the patients. So it is absolutely advised to go with both allopathy Ayurveda. There won't be any interaction between both the medications as such.
Okay, thank you so much, ma'am. Hope patient clear their queries, and I hope we have almost covered all the important topics today. And I'm really grateful for today's session. It was really very helpful for us and for patient also. And I would like to thank doctor and dietitian ma'am for your valuable time and useful tips. And so now we can understand like how a small change in food and like natural practice can bring comfort and strength to the cancer patient. And really this session was very grateful, and I'd like to say again thank you so much. Have a great day. Thank you, ma'am.
Okay.